How many times have you left the doctor's office or chiropractor or physical therapist and you got an adjustment or prescribed some medication, got some at-home exercises, and you left there thinking, wow, okay, but where's this gonna take me? What is the plan moving forward? Well, if you're tired of not having a plan, let me explain to you our 3 phases of care. Here at Premier Chiropractic, what we do is we break down our treatment plans into 3 phases. Our first phase is the acute phase. This is where we get you out of pain. Our second phase is the rehab phase. This is where we get you moving, functioning better, and feeling better at the same time. And our third phase is the maintenance phase. Once we've cleaned everything up, got down to the root cause of the problem, corrected that, now let's keep you going for the long haul. Phase 1, our acute phase. You come in with low back pain, headaches, you just got injured, whatever the case may be. Our first priority is to get you out of pain. What can we do to improve the symptoms of this injury? So this is going to include a lot of manual therapies, some therapeutic modalities. We want to reduce the inflammation around the injured area, get you moving, get those ranges of motion back, and get you to where you need to be feeling good. But this is also going to have a little overlap with phase 2 when we get into our rehab phase. We want to start strengthening and stabilize the injured area, so when we start breaking down movement patterns, we know that you're able to move forward without injury. Now, once we've gotten you out of pain, we've restored some of that range of motion, now phase 2 is really where we're going to make the most improvement. This is what we're going to find, and what we're going to focus on is called that root cause of the problem. Why did that injury happen in the first place? Why is this chronic pain still reoccurring? This is where the functional movement systems that we do here in our office are vital. We want to make sure that there's no mobility issues or stability issues that's causing these injuries to occur, this chronic pain to reoccur. Now, once we've taken you through that thorough evaluation and that assessment, we're going to break the areas down that we found to be problematic. We want to make sure there's not a joint issue or soft tissue issue. We also want to make sure that there's not a neurological issue, because now our rehab may become more neurological based. We got to look at these movement patterns and say, hey, look, have we been doing this dysfunctionally for 10, 20, 30, 40 years? And this pain is just now becoming too much to handle, or it's affecting some part of our daily life? Well, what we have to find out is, how can we recreate new patterns so you can move better, move more efficiently, and without injury moving down the road? Because if we let these issues go for another 10, 15, 20 years, we may look at larger issues. We may look at a lot of osteoarthritis. Now we start talking about joint replacements or fusions, and we all know that's not something that we want to encounter. So let's jump on this early, whether you're having acute pain or you're not. This phase 2 part of care, this rehabilitation, this re-education phase, is vital. And finally, phase 3. We've done all the work, we've gotten you moving better, we've rewritten new movement patterns, the brain feels strong, the body feels strong, and our susceptibility to injury has gone way down. Now, where do we go from here? Do we just throw you back into the gym? Maybe, but what happens if you get back into the gym and get stuck and those old patterns start to come out again? Well, this is where that maintenance phase comes into play. We may have periodic checkups. We may put you through movement evaluations ever so often to make sure that we're not going back into old habits. We want to make sure that these new movement patterns stay in the forefront of our mind, and they show up in areas where they're truly needed, without my help, without the feedback that we give you here in the office. So let's stop worrying about these short-term quick fixes for these issues that have been going on for a very long time. And unless if we get into a car wreck or a sports injury where we twist and tear something, most of the complaints that we see here in our office, these musculoskeletal complaints, have some underlying cause, that root cause of the problem that have been manifesting for years. So if you're ready to take control of your health and really knock out that chronic pain for good, let's start. Let's get you in here. Let's get you through that full movement evaluation, take care of that acute pain in phase 1, re-educate the body in phase 2, and then reinforce those patterns in phase 3. So don't wait, let's get started.